Hey guys, it's Dave. Today we're going to talk about a topic that was brought up on a live on our TikTok, collagenous colitis, which is actually a form of microscopic colitis. And why they call it that is because it actually can't be seen unless you have a microscope looking at the intestinal wall to actually see it. It is a type of inflammatory bowel disease. It involves predominantly the colon or the large intestine, but it actually can move up into the lower section of the small intestine. What happens is inflammatory cells are released from the immune system. They travel to the colon or the lower section of the small intestine and cause inflammation. They really don't know what exactly is going on with it. There seems to be an autoimmune response aspect to it, as well as possibly a genetic aspect to it. And also, because of the inflammation and how it's involved with the immune system, they think it could be caused from an infection, because a lot of times you'll see an infection and then after the infection you'll get a flare-up of this. What's going on is because of the inflammation, the colon cannot absorb or reabsorb the water like it's supposed to, leading to watery diarrhea. Now, with this, as far as genetics, if your parents have had IBS or grandparents, you are more prone to actually getting this. If you've had an infection, and predominantly the two main infections that you really can look at causing issues with this are C. diff, or Clostridium difficile, or Campylobacter jejuni, which those are the two ones that can really cause an issue here. Medications can cause issues with it, but predominantly you'll see a flare-up if you're on these meds. And meds like statins for cholesterol, predominantly mainly Zocor or simvastatin, NSAIDs, so like ibuprofen, oral diclofenac, naproxen, just to name a few, or aspirin. They can cause an inflammatory response. Even though they're anti-inflammatories, it can still cause an upset in the area of the large intestine. Proton pump inhibitors, so omeprazole, Prevacid, Nexium, that group right there can cause issues with this, which is why it's important you should only be on those low dose for as short a time as possible. Blood pressure medications, mainly beta blockers, so drugs like propranolol, metoprolol, carvedilol, drugs in that class, the OLOLs, they can cause issues with this. You need to talk to your provider because you don't want to stop those medications. They're very important, especially in heart medication or heart patients, because they can do way more good than harm. You don't want to stop those without having a discussion with your provider or cardiologist. Acarbose, which is a diabetic medication, can cause issues here. There are better alternatives. Talk to your provider about that. Hormone replacement therapy. So drugs like estrogen, Premarin, even birth control can cause issues with that. Vivel dot or estradiol patches can cause issues with that. Again, talk to your provider about that. Selective serotonin reuptake inhibitors. So drugs like Paxil is a bad one, or paroxetine, citalopram, escitalopram, sertraline, fluoxetine. All of those medications can cause issues with this. Again, talk to your provider before you stop any medications. Topamax or topiramate, which is a mood stabilizer also used for seizures. Tegretol or carbamazepine also can cause issues with this medication. Another culprit that they have found could be that your bile acid is not being absorbed the way that it should be, which can lead to this type of colitis. Now, what you mainly are seeing here, like I said, is watery diarrhea. No blood in it. If there's blood in it, get to a provider right away. Bloating, stomach pain, weight loss, which is associated with the diarrhea, dehydration, which again is because of the diarrhea. You need to make sure you're taking plenty of fluids in. Nausea, joint pain, weakness, and fatigue. Those are all symptoms of this disease. The good thing about this disease is it does not put you at a higher risk for colon cancer or death. So that is a good thing about this. Patients at risk would be those with irritable bowel syndrome, diabetes, thyroid disease, celiac disease, people over the age of 50, especially women. And that could be because it's tied into the hormone replacement therapy, because you see a lot of women on those kind of treatments over the age of 50. Then smokers. And the reason for smokers to be at risk is smoking affects the blood flow to the GI tract, in it, the whole tract, not just the colon, but to the GI tract. So that is one thing you need to look at, is stopping smoking. As far as treatments, of course you can use the antidiarrheals like loperamide or Imodium, diphenoxylate atropine, which is generic Lomotil. You want to watch out for the amount you take there. But short-term use of the drugs that follow generally will take care of it. Budesonide capsules, bismuth salicylate, Pepto-Bismol basically, sulfasalazine, mesalamine, immunosuppressants, and it depends on what you're looking at, like generic Imuran can be used and some other ones, cholestyramine, cholestipol, I'm going to butcher this one, it's a generic Welchol, okay? Those are all bile acid suppressant or bile acid sequestrants. So that's how they work to help get your bile acid in check for those patients that are affected by that. Now, those would be used for a longer term, okay? Cromolyn, the oral cromolyn, not the nebulizer cromolyn or the intranasal, the oral cromolyn will help out, as well as low-dose naltrexone. So again, there's something else that naltrexone is being used for in low dose and having success. Again, like I said, the majority of those can be used in short-term, basically like a burst, and then you're on it for 4 weeks or even less, and then you come off. Because what will happen is the disease will go into remission. But unfortunately, it doesn't necessarily go away for life. It'll go into remission for weeks, months, maybe even years. But something generally will set it off to come back. Symptoms will come and go, can be worse at certain times for people and then be better at other times. You have to watch things like your diet. Your diet, you should have a decrease in the amount of caffeine you take will help. Decrease in the amount of dairy you take in will help. If you have foods that are high in fat, try and limit those because that will set it off. Artificial sweeteners will set it off. Alcohol will set it off. Again, stopping smoking would be a key. Gluten-free or Mediterranean type diets have had some success in decreasing symptoms and the amount of times in a given year that you will experience the symptoms of watery diarrhea, bloating, stomach pain. So you should look at things like that. Probiotics, predominantly anti-inflammatory probiotics, which is the bifidobacterium. A certain type of probiotic that carries a lot of that is Floristor. So if you can look at that one or the generic, that would be a probiotic you'd be looking at. Fiber, and fiber on a daily basis. Every day getting in a good amount of fiber, and if you can't, look at something like Metamucil. Not only will it help with the diarrhea, but it will help with the toxins in your system. If none of that works, unfortunately, you may be looking at removing part of your colon. Now that is an extreme, but for a lot of patients, it has been successful. You want to talk to your provider about anything that I mentioned, especially stopping any of the medications that were mentioned, because it may do more harm than good to stop them. And it is first priority is to talk to your provider first.